फर्क है, कुछ होने में और बहुत कुछ होने में। इतना सा फर्क है एक बार सोच के छोड़ देने में और लग के कर दिखाने में। मान लेने में कि जिंदगी ऐसे ही कटेगी और सुबह 4 बजे उठ के सोचने में ये अभी तो बस शुरुआत है। किसी मैगजीन को हाथ में लेने में और उसी मैगजीन के कवर पेज पे होने में इतना सा ही तो फर्क है। वीआईपी सीट में और उसकी पिछली सीट में इतना सा ही तो फर्क है। वो जिसका मैदान ही खुला आसमान है, वही कल जमीन पर तो था। पूछोगे तो बताएगा वो पंछी, ये एक दायरे में सिमटने में और पूरी दुनिया को दायरा बनाने में बस इतना सा फर्क है। इतना कितना है? इतना है या इतना है? जो नापेगा वो जाने कि जहां धरती और आसमान मिलते हैं, नानकुर से दूर, अगर मगर शायद से दूर, वहां भी दोनों में फर्क बस इतना सा ही है। धरती और सातवें आसमान में फर्क बस इतना सा। ये एक अंतर प्रेरणा, ये हमारी, आपकी, हम सब की अंतर प्रेरणा। एक कदम, एक छलांग, एक बाजी, एक गहरी सांस और एक ललकार खुली हवाओं में कि हाँ मैं बना हूं उन फिजाओं के लिए, कि हाँ मैं बना हूं उन ऊंचाइयों के लिए जो ऊंची तो बहुत है पर नामुमकिन ही नहीं, क्योंकि मुमकिन और नामुमकिन में बस इतना सा फर्क है। धूप छांव में फर्क बस इतना सा है। तो बस चलिए फ्रेंचाइज इंडिया के साथ ये फर्क मिटा देते हैं। फ्रेंचाइज इंडिया, 20 years of ideas.
A very good afternoon to all the dear friends who have joined us today for our webinar series. Franchise India teams welcomes each one of you to Business Opportunity Over Chai. This is a digital platform where our aim is to present the business opportunity for each one of you, where you digitally interact with the brand representative founder so that you get the understanding about the kind of the business model and the franchise model they are representing today. We welcome management team of Franchise India, Gaurav sir and Sonia ma'am. They'll be sharing their insights, their suggestions, viewpoint with each one of you related to the industry as well as different franchise options. The brand which we are representing you today is Sunburst Healthcare, and we have invited Sujata ma'am to talk about the healthcare industry, market opportunities, as well as the franchise model which she has got for us. Ma'am started her journey with her husband for Sunburst, and we invite her to talk about her journey, how she started this particular venture. And it is for all of us, she's an inspiration. Thank you so much, Sujata ma'am, for sparing time today and joining us to share your business model with all the investors who have joined us today. Over to you, ma'am. Namaskar.
Namaskar. Can you hear me?
Yes, we can hear you, ma'am.
Okay.
Welcome.
Hi. So, good morning, everyone. I'm very excited to be here this morning. Basically, I am Dr. Sujata Malik, a clinician and a healthcare management expert. I have been in the industry for last 35 years, and 3.5 years ago, I decided to begin my entrepreneurial journey and founded this company called Sunburst Healthcare, which is a private limited company with my husband, who's a retired army officer. Basically, what we are trying to do through the company is to enable home healthcare professional services across the length and breadth of India. We started out in Pune, and here we have acquired quite a name. We now intend to take this venture pan-India, and already we have a franchisee in Bombay. And so we are hoping to see how we can garner more partners and take this enterprise forward. Would you want me to start the presentation now?
Yes, ma'am.
Yeah. Is this okay?
Perfect, ma'am. Thank you so much.
Yeah, pleasure. So as I said, Sunburst Healthcare Private Limited set out on this journey to change the way healthcare is delivered and accessed in the country. And that was our vision, basically because we felt that healthcare is too much of provider-centric industry, where the provider decides what the consumer will need. And we did feel that there was a need to change perspective, and that is why Sunburst Healthcare was founded. So our presentation today will be in 3 parts. We will talk about the market opportunity that home healthcare presents to us. The second part will focus on what is Sunburst as a brand, as a corporate. And the third part will talk about what the franchise proposal is about, how it will function, what will be the parameters of this franchise proposal. So talking about the market opportunity which home healthcare presents. Now, this is actually a totally untapped and almost a virgin market. I would say it is a sunrise sector in the healthcare industry. Healthcare itself is growing very rapidly at the pace of about 20 to 25% of CAGR. And it is expected that home healthcare would actually exceed the growth of the healthcare industry. It is expected to grow at 30 to 40%. And here we are saying that it would reach 6.2 billion by 2020. But now the time we are already ahead of that. And it actually is slated to reach up to double of this in the next 5 years. So it's a huge momentum that the industry has at the moment, and it is the right time to be in the industry. And we have the advantage of being early starters, of having understood the industry and gained enough knowledge to take this ahead. We all know that India is home to the second largest geriatric population in the world, and there are about 9 million Indians who are above the age of 60. So these are clients that we are going to focus on, but home healthcare has gone much beyond the geriatric care capability that it had, or it was understood to be an industry which was only focusing on the geriatric population. Now it is different, and I'll tell you how it is different. So India has, again, cancer patients are on the rise, all kinds of lifestyle diseases are on the rise, the life expectancy has increased. People even want to focus on their health before they get illnesses. People want to focus, be proactive about their health, to live in positive health and avoid disease conditions from emerging. And with that, there are, certain key drivers that we are now looking at. The changing demographics of the population. So we have a large amount of young population, which is upwardly mobile, which has higher disposable income, which has, which is technology savvy, who know how to use technology. So what we are saying is, if a movie ticket is available from your mobile, if your groceries are available from your mobile, if your food can come home, if any kinds of gadgets are coming home, then why not healthcare? And actually it should be so, because for every little thing you should not be stepping out. The hospitals are important, but those should be reserved for the people who actually deserve that kind of care. So looking at the market in India, as I said, the market has been growing, and by all kinds of estimates, very conservative, we should look at something like this: $10.8 billion market in 2025. If we go by aggressive estimates, then it is looking something like $13 billion. So we are in the right space. This is a growing space. We are all, poised for a big exponential rise in this industry, growth in this industry. Now coming to the growth factors, the factors which are actually pushing this growth. some time ago, it was just, when we spoke about home healthcare, people only understood it as the nursing bureaus who send nurses home or some such thing. In fact, when I started the company, people were wondering how, after, being in the driving position in large hospitals, I was looking at something like home healthcare, which was not at all glamorous. So, but I had a belief in this industry, and I have a belief that India does need home healthcare. Coming to the doctors' acceptance of home healthcare. So what is happening now that we are noticing that doctors are themselves advising the patients that you can now go home, you can get good professional home healthcare services, and they are doing the recommending to the patients, which is actually triggering them to seek home healthcare and opt for professional home healthcare. Home healthcare, by the way, is available at a fraction of the cost at which hospital care is available. So why not opt for it when you can get professional care at home? Insurers are now opening their eyes to the availability of home health care. They are now realizing that it costs less, so it would be a profitable business for them if they are able to ensure that the right people are seeking home health care. Then to cover home care is much better than covering care in hospital. So one can look at discharging patients early and providing them with good professional home health care. And finally, looking at other countries where home healthcare is actually an established facet of healthcare, there is no reason why India should not follow suit. India has the potential, the need, and the market to take this ahead. And I'm sure that in the coming 5 years, you will see a massive change in the way that healthcare is accessed. It's already happening, but it will become more and more manifest as days go by. So who are our target population? Of course, the ailing people are our target population. So somebody who is aging or who needs long-term care or who needs care after discharge or after a surgery, or people with mobility problems who want to have care at home, pain, palliative care, lifestyle diseases, and so on. But there is a large subsegment who is not even ill. They also need health care at home. They want to access preventive care. They want to have a nutritionist guide them. They want a psychologist to look at their mental health needs. These people are educated. They have access to technology. They could easily access healthcare from the comfort of their home. They want to be ready. They don't want to fall ill. They want to do something to prevent themselves from falling ill. And why not? Because health, if you sort of invest in it at the right time, you don't have to reach the stage when you are into lifestyle diseases, when you become grossly diabetic, when you develop a heart disease. That's not the time to access healthcare. The time to access healthcare is when you are healthy, when you want to keep yourself healthy. And these are the people that we want to target as well. We do not want to target only the ailing. We want to keep them from falling ill. And so families also could be good buyers. People who have elderly family members, like children of elderly who want to get their families treated. Those are also important target population, and these people are the ones that we always keep in mind when we are marketing ourselves or we are doing promotions. Apart from this, just anybody. Everyone needs home health care. And so it is up to us to target the right population, to actually sell ourselves to anybody who needs health care. It's time when people should start saying, no, I don't need to step out to get health care. I need to get it at home. And it's easily possible. Everything is possible. In fact, a lot of it is possible. So for little things, going out and exposing yourself is not required. So the idea is to change people's perception about healthcare from being curative to preventive, passive to proactive, and an investment rather than an expense. The pandemic did its bit to change everybody's perspective towards healthcare. and home healthcare has started coming out into its own. So I would get calls during the pandemic asking me, can you do this at home? We don't want to take our patient out to the hospital. And we have people like surgeons, like orthopedic surgeons, like, different types of people who are accessible, who go to the patient's home if required, who do video consultations if required. I mean, the way of people accessing healthcare started to change with the pandemic coming in. So, the acceptance suddenly increased. I will just tell you about a couple of important things that we did, some things that we have to show for during the pandemic. So we did, home monitoring package for the people who are in quarantine at home. And for 15 odd days, the person was monitored by a senior doctor every day, who understood the day-to-day changes in the patient, who put in interventions at the right time, prevented patients from getting hospitalized. And this endeavor was hugely appreciated by our clients. So, patients were very eager to get enrolled in the program, and it was not absolutely at throwaway prices. It was reasonably priced, but 15 days, the person was at a given time, every day, he was monitored by the doctor, he was given advice, prescription would come, and the patients were fully taken care of during the period of recovery from COVID. Another very interesting exercise that we did during this time was we had a post-COVID recovery and rehabilitation package that we did with one of our corporate partners. So they have their employees spread across the length and breadth of India, and we did this post-COVID recovery package over 150 locations for about 350 patients. And this was another very interesting exercise because it was multidisciplinary. So it had not only a doctor, but also physiotherapist and a dietitian and a psychological counselor, all of it, and even psychological testing for that matter. So we came out with very interesting findings, which were very helpful to the corporate. And this was a great way of the corporate connecting with the employees, engaging with them, and I'm sure the employees must have drawn great benefit from it. So what I'm trying to say is that there is a lot that can be done in home healthcare apart from the usual device rentals and the nursing and such things. They are also important, I'm sure. We come to the corporate profile of the company. So we were incorporated on 1st of November 2017. Initially, we were into two divisions. So Sunburst Healthcare at home, and the other arm was the healthcare management consulting vertical. Slowly, we are whittling down the second vertical, which we are now doing through a new company called Iconic Healthcare. We are going to focus on only home healthcare through this company. We are a startup which is duly registered with DPIIT, and therefore we have all the benefits of a startup. This is our team. So, of course, it is being spearheaded by me because of my vast experience in the healthcare industry. My husband, Colonel Malik, has also 35 years of experience in the army, and army experience is also multifaceted, and there is a lot of knowledge and experience that is there in logistics, in manpower management, and so on and so forth. Advocate Nupur Batura is another director, and she takes care of the legal advisory. Ms. Diksha Ahuja is our business consultant. The Dr. Priyadarshini Kulkarni is our palliative care and pain management consultant. This is an important aspect of our services. So we have, included her in our managerial team. And of course, we have our technology team, Smart Health Global. Now, coming to the problem that we are trying to address. There is, as we said, that Indians are now living longer. The demographics of the population is changing. There is a growing burden of lifestyle diseases. There is a demand for existing hospital services which far exceeds the supply, and therefore hospitals, we feel, should be kept reserved for people who actually need hospitalization and should not be used for petty purposes. The healthcare costs, we all know, is going through the roof. Anybody who has ever accessed healthcare comes out complaining that it costs too much. So home healthcare has the potential to provide the same care in the comfort of your room at a fraction of the cost. And that's why it is important. It's really an important aspect of healthcare. People keep visiting hospitals for unnecessary reasons, and that can be easily avoided. The treatment compliance, what happens is when patients get discharged from hospital, they are given certain advice, and what they do is they get lost to follow up when they go home, where they start thinking that they are now all right, they don't need to continue medication, they don't need to be monitored, and they come back to the hospital in a state that they'll suddenly come to emergency in a compromised state, in a decompensated state, and most admissions which take place through the emergency are the ones that cost the most. So planned admissions, if you see the bills of patients who come with planned admissions, are not even half of what would happen if the patient comes in an emergency. So the best way to avoid emergency admissions is to have a good home health care cover. And we all know that this facility does not exist in any quantity in India. So just to give you a small perspective on what kind of lifestyle diseases are we looking at, because we have the first thing that we have spoken about is lifestyle diseases, and we are looking at a huge burden of lifestyle diseases in India. Diabetes, 77 million. We are known as the diabetes capital of the world. And this is actually all these diseases are, they are part of the same syndrome. It is called a metabolic syndrome. So anybody who is diabetic becomes more prone to heart diseases, to kidney diseases, to stroke. Some cancers are also born of the same profile of patients. So basically the thing is that, one, if we were proactive about our health, if we took action early to keep our health in order, we would not be falling prey to these diseases. And it is possible to do. And this thing needs to be understood by our clientele, that you don't have to fall ill to start seeking help. You have to take it before that. And home healthcare is the way to go if you want to do that. So what did we do? That was the problem. And we have now, we have designed our solution to target that problem. What are we trying to do? We are trying to build an ecosystem where healthcare can be effectively delivered at home. So what we are doing is we curate the supply side. There is an amorphous mass here. The supply is totally, it's an unknown commodity. People don't know what they are trying to access, what is the kind of care that they should get. So we are the enablers. We are building an ecosystem. We are getting the supply in order. We are, putting it in a logical way, and we are connecting it to the people who need this help, and trying to make healthcare positive, proactive rather than reactive. So, and we are trying to create a continuum of care like this, which means if a patient gets discharged from a hospital, he should get the same kind of care at home. And then, so there is a continuity of care between the hospital and home. And this is what we want to do. And this is a logical and a scientific way of looking at it. If we don't do this, then we are going to keep coming in the same kind of, coming up with the same kind of problems. The patient is treated in the hospital, goes home, nobody takes care to the extent that it is required. There is no monitoring at home. Again, goes into an emergency, reaches the hospital, and this cycle will continue, and costs of healthcare will not be in control. by just doing this much, we are going to be able to control cost of healthcare to a large degree. So what is our value proposition to our clients? So we are here and we have the customers or the patients on one side, and we also have, hospitals on the other side. And we know that we add value to both these parties. So what are these parties and what do we do for them? So for the customer, home healthcare can actually replace 65% of hospital visits. And this is not me, it is an international study which says this. And what we are seeing is that 70% of the patients in India pay for healthcare out of their pocket. So insurance coverage is poor, payer coverage is poor, and most of the Indians have to pay for healthcare out of their pocket. When they do that, you can imagine what happens to their families and their incomes and their savings. So there is a direct cost involved. So what is the direct cost? It is the hospital bills, which are huge. We are saying that there is a 20% saving on treatment cost, but I would say it is an 80% saving on treatment cost as far as I know. And indirect cost, if a person falls ill in the family, we have seen how a family member has to accompany, he has to take a leave from his work, he has to sacrifice his working day. Sometimes even if the person has a minor ailment, he himself could have gone to work after taking some treatment at home. Instead, he goes to the hospital, stands in a queue, waits for the doctor to come, does whatever, wastes a lot of time and effort. The commute itself is expensive, and there is no need to do all of this. There is so much available, and this is what we want to bring to the table. We want to tell the patients, everything doesn't need you to go to hospital. You can do it at home. There are many things which can be done at home. And we don't understand that hospital is a hazardous environment. So hospital acquired infections can increase hospital stay and costs by up to 5 times. What it means is, which is humongous. We don't realize it. Actually, the patients who overstay in hospital just for the sake of physiotherapy or a simple injection to be given, they should have been discharged much earlier. Going home, the home bed is free. You don't have to keep paying the charges for the bed. In addition, you are not prey to so many of hospital acquired infections, and these infections which slowly creep up on patients who are staying longer than necessary in hospital can really increase the cost of healthcare. So we have to be aware of these things, and these things will make a big difference to the cost of healthcare for patients. Now, coming to hospitals, if hospitals have a home healthcare agency, which is so if they have a tie-up with the home healthcare agency, the compliance to treatment improves. So when the patient goes home, he is told that you will be monitored by a home healthcare party like this. They are our partners, and so the patient understands that this healthcare provider is concerned about his health, not just about the bills. So the loyalty factor comes into play. The patient understands that this is a brand which is geared up for everything. So they know that the health of the patient is important, and we are not just looking at the patient getting readmitted in emergencies, and that is not the right way of delivering or accessing healthcare. Coming to the profitability for hospitals. I don't know if many of you know that hospital, when a patient gets admitted, it is only in the first 3-4 days that the patient brings the kind of revenue that is expected of a hospital bed. After the first 4-5 days, then he is more a drain on the hospital resources, and then he ceases to be profitable to the hospital. So bringing down the average length of stay is one of the success metrics that most hospitals measure. Now, this just having a good home healthcare partner could bring down the average length of stay and improve the profitability of the hospital. So they would get loyalty, they would get stickiness, The home healthcare partner, as far as we are concerned, we are totally non-aligned. If we don't have any say in which hospital the patient goes back to, we would rather the patient remains connected with his original doctor, and we remain the the home healthcare agency, and so he keeps going back to the same hospital for his needs whenever whenever it is necessary. And the hospital benefits, the patient benefits. And sometimes what happens is, if patients overstay, then at the end of the day you find that they are unable to pay lofty bills which come up, and that can be easily avoided, and the write-offs that the hospitals have to do when the bills are when the patient is unable to pay the bill, these can be avoided, and these are straightaway losses which the hospitals incur. So being here gives us the advantage of being of value to both our partners. And what we are trying to do also is to look after our patients and to create a healthcare infrastructure where the information that we acquire through care of our patients will then be used for AI-driven predictive healthcare and for customizing healthcare. So what it means is that from this data, we will understand what our customer needs are, and we will understand what we can do better for the patients and what specific care can be given to which patient. So this is our value proposition for our patients and for the hospitals and our partners. So what is our business model? As I said, we are the ecosystem enabler, and what we are doing is we are matching the supply to the demand. So we create a supply, we categorize the supply, we kind of put some reasoning to it, that what kind of supply is needed, what are the needs of patients, and we create this supply. So right from, say, attendants to remote monitoring devices, specialist doctors, what have you, is what we are creating a supply for. And we match this supply to the demand, so patients can reach out to us and they can get the healthcare services that they wish to access, or that are suitable to them. And we are enabled by our technology. So we have our new technology, which I will be speaking about shortly, is well geared up to meet the needs of the patients. So what we did is, in the first 3 years of our operations, we have established our B2B and B2C contact associations, but we are still in the process of acquiring more customers, more associations. We are at this stage right now where our tech infrastructure has been developed, and so we have just completed about 3 years of operations in the home healthcare arena. So our technology is now ready. It is already launched on Play Store, Google Play Store, and is now getting launched on the iOS platform. Finally, from here, where we want to be is to understand the healthcare status of our patients, and to kind of understand population healthcare and start putting in interventions so that people can maintain better healthcare. And as I said, not resort to reactive healthcare, but to use and to try to access proactive and positive healthcare. So this is where we intend to be in the next couple of years. Now, what is our service mix? So being here, what we are trying to do is, we do everything that is healthcare which can be done at home. So whether it is a doctor who goes home for a consultation, or it is telehealth, or it is nursing or rehabilitation, mental health, palliative care, pain management, what have you, we are the one-stop shop. We also do something called patient facilitation, patient concierge services, even second opinions, so all of that. And of course, our clients are the hospitals, because they would like to advise their patients to go home and take home health care. The corporates, as I explained, some of our corporate tie-ups have actually made very good use of our availability in the market. And of course, the individual patients who can access home health care on demand. So both B2B and B2C kind of arrangements are there. And we intend to kind of again, match the demand to the supply to the demand, and also collect data, and then analyze it, and come to a stage when we can make a difference to the health of the population. We are actually trying to reach there. We have to go one step at a time, but that is our thought. So our go-to market, as I explained, I'll just explain the logic behind it. So hospitals, these are strategic tie-ups. So people, if I have a tie-up with a large hospital in a particular city, there is a certain trust that comes in, because the hospital understands healthcare. And if I'm attached to a hospital, they will feel that, yes, this is a party which can be trusted. There is a continuous demand coming from there. Customer acquisition cost is less. The brand value is improved, and trust comes. And with corporates, again, these are strategic channel partners. They are bulk buyers. There are multiple employees which will access our facility. There is a low customer acquisition cost. Marketing spends can be reduced, and we have access to their network, whether it is their vendors or their supplier, whatever it is. So in a way, having a corporate tie-up is of use. And similarly, finally, on demand, when we are doing these patients directly approach us, we have also put in place some subscription plans which are there on our website. And then the patients have the advantage that because we have everything under one roof, they can access any service that they want, and they don't have to go to multiple players for their home healthcare needs. We understand quality in healthcare, and we are committed to it. So when they come to us, they start understanding that they have come to a good party, and they a good provider who knows what they are providing, and who are going to give them professional services, and who will be concerned about their well-being. In fact, sometimes I have experienced that the patient first talks about money, but when he understands what is going on, and the kind of comfort that we are able to give them, and the kind of understanding that we are able to create, then money does not, it just disappears out of the picture. It's more they want to be taken care of in the best way possible. So we are we become a trusted brand. Patients know that, and we have got good word of mouth publicity. Patients who have used our services definitely recommend us to whoever they come in contact with, whoever their friends, their family. And we have had multiple patients coming from the same source. And of course, our technology is our big asset. And we are very proud to say that within 3 years of having started the business, with not much understanding of the business at that stage, today we can proudly say that we have a technology which supports our entire operations. Best part is that we are an asset light model. There's no much expenditure required. The capital expenditure is quite minimal. And we are already financially sustainable. We actually don't take money from anywhere, no debt, no nothing, and we are running the organization in a profitable manner on our own. And so there is no reason why our franchisee partners should not be able to do so. So what is our competition like? So there are hospitals who have their own home healthcare companies, means companies as in they have that division which is doing home healthcare, something like Apollo doing it, Max doing it, and so on. There are hospitals which have outsourced home healthcare partners. So for example, Columbia Asia or Manipal or Fortis, they have their own connections, and they are doing it with their own partners. So our job is to kind of look at how we can partner with such hospitals. And finally, there are private home healthcare players like us, for example, Portia, HealthSpring, Healthcare at Home, Nightingales, and so on. Now, how are we different from them? Healthcare is a business of trust. So people want to be associated, or patients want to take services from a party that they can trust. So there has to be a good face to the organization. They should know that yes, they can reach out to you when they need help. If something goes wrong, you will take the appropriate action. So this is the trust that we have been able to inculcate in our clientele. We are available right now in Pune and Mumbai, but we are there now trying to increase our reach to many other geographies in India. We understand healthcare, and therefore we will do what is right for the patient. If we find that the patient is asking for something which is not right for him, we will flatly refuse to do it. We don't believe in doing anything which is not correct scientifically, and which is ethically not correct. So we make sure that, for a little money, we don't try to cut corners. We are data driven, and therefore what we are trying to do is collect data and then use this data to improve our care to the patients. And we have a strong B2B connect. So this makes us, I should say, in some way better than our competition, and enough we have a fighting chance to to outrun our competition and do. Though it does not bother me, there is space for everybody, in this market. It is a untapped market, it is a virgin market. We have all the potential to do well in this market. So now, coming to the franchise proposal, what does our partner have to do? Obviously there will be need of a space, so up to 200 square feet space is enough. Having a space, having a person in, 1 or 1.5, 2 persons is more than enough to have in a particular location. Being near a multi-specialty hospital helps, because you will have a direct drain of patients. You have to be able to reach out to doctors, because the people who have practice and surgeries, these are the people who are going to refer patients to you. You will have to do some local city marketing to generate interest, and you will have to also identify sources of manpower, which of course we are there to help you with, but finally you also have to do something to reap the benefits that that Sunburst Healthcare is going to help you get. And you can have, you don't necessarily need to hold inventory of medical equipment, but tie-ups are enough. Initially, I would recommend have a tie-up with the equipment providers, and later on, as you start understanding the market, then there is no harm in holding some inventory of medical equipment. Now, our financial model for the franchisee. So the franchisee will be paying a fee of 10 lakhs. The interiors and something, for the shop itself will cost about 1 lakh. Office equipment of 1 lakh. Again, this can be, it's flexible. You don't necessarily have to spend this amount, but it could be up to 1 lakh. Marketing initial, again, the physical marketing is in your purview, but the digital marketing, we will be bearing the burden of that, because we understand it and we want to project the brand right. The couple of licenses are needed, not too many, just a Shop Act license. And initially you don't need a GST registration. Yes, if you are registering as a company, then you will company as in as a legal entity, then you might need a PAN card, and so that might be needed. Total amount of expenditure that is expected is 12.75 lakhs. What we are expecting is that what we normally our average ticket size is about 1,200 rupees for a service, and we are expecting that you would be doing about 750 individual services in a day. The monthly revenue is expected to grow like this, initially at a faster pace, maybe little lower as the years go by. But again, my experience has been quite different. In fact, I was telling our our financial experts that we have seen completely exponential growth. So there is no reason why the franchisee in a untapped market should not see the same. So even though these are conservative figures, and home healthcare is growing at a rate of 31%. What we have shown you here is that very conservatively, you are likely to break even at 24 months. So that is the maximum that can happen. But it would be, I have some belief that this would be much better, that 12 months is sufficient to break even. Our major cost is manpower. So we spend almost 70% of our revenue in the manpower who service the requests. So a nurse who would go to the patient's home and who would do a 12-hour or a 24-hour duty, or a doctor who would visit, would be paid around 70% of the revenue, the charges that we collect from the client. Apart from this, the margin, which is 30%, Sunburst would be paid 30% of that margin. So which comes to about 9% of the total revenue. This will be the recurring fees that you have, the revenue share which you have to pay to, the 9% share which you pay to Sunburst, which is like 30% of the margin. This margin only excludes the manpower cost, because manpower cost is the bigger cost. The rest of the expenditure has to be borne by the franchisee from his margin. And after you do that, the return is such that within 2 years, very conservatively, when we are not doing anything heroic, you should be able to break even at 24 months. So this is what we expect, that the financial model for the franchisee will be like. Now, who are we looking for? Who are our ideal partners in this business? We are looking at people who can operate this business. So people like large pharmacies who are still new to this mode of healthcare delivery. They might be suitable partners. We also, of course, the doctor community would be very suitable partners. So doctors or healthcare workers, so orthopedic surgeons, physiotherapists, general physicians, palliative care, medical equipment retailers. People from non-medical background would make suitable partners if they are supported by somebody in the healthcare industry. So it would be good if there is somebody in the team. It is almost essential that there has to be somebody who understands healthcare. We are there to support. We are there to make you understand. We are there to hold your hand during the operations. In fact, we are a very reachable organization. So anytime, I am among those where, me and my team are accessible 24/7, so to say. So we make sure that we should not go wrong at this early stage in our entrepreneurial journey. And the people like doctors who already have some kind of setup and who want a multi-unit opportunity are other very suitable clients. Now, what we are looking at is a very small investment. 12.75 lakh, which is the upper end of this thing, is not a great investment. It's a small investment, and we need strong operational capabilities in our partners. So we will be looking for partners who can invest this amount and who can be very good at running the business. And of course, we definitely would want one healthcare trained professional who will be part of the team. Being a kind of a employee is fine, but having one person on the team is mandatory. This is our Mumbai franchisee. They are already operational. Dr. Vanrekha Parekh is a consultant anesthesiologist, and they are a family of doctors, so they also run a ENT hospital, and we have this unit which is running now completely on its own, and they've understood our model, and we are very happy to say that the citizens of Mumbai now can access home healthcare with Sunburst Healthcare through our franchisee there. What do we bring to the table? So pre-opening, we will be, completely guiding the franchise partner on how to set up this business, because we don't want to go wrong there. Our model, our knowledge, which we have acquired over the years, and now we want to transmit it to our franchise partners. What is it you have to do? How you have to run your business? So this complete thing, including price points and everything, and how you have to position yourself, is what we are going to support the franchise partner with. The manpower recruitment training, here again we will play a very pivotal role, because this manpower is going to be our face. They are going to carry our brand to the client's location. The marketing plan, helping in designing the marketing plan and its execution, will be our responsibility. After opening of the franchisee, we will be helping in liaising with the hospitals. Being in the industry for so many years, we have a good connect with hospitals across India, because again, there is a certain strength which comes from knowing the industry. What we have also done is that we have not left anything to chance. We have got a very extensive written down manual of SOPs and policies. This is going to be shared with each partner, and so that the partner does not have to guess what he's supposed to do. He will have written guidelines on everything. And of course, we are there to again hold hands with him and to take him forward. And then business development. So digital marketing is completely run by us, and we are happy to support the to support our partners with the digital marketing. We want to make sure that our brand position is not compromised in any way. Our price points, which are premium, which are not very bottom of the line kind of price points, we would be happy to share them with our partners and help them realize those price points, of course subject to the kind of location that they are in. We also have our technology platform, which I have been speaking about all this while, and now I will explain in a little more depth as to what we are going to do. So we have this web portal called Health Access. This is our admin portal, and it is already live on Amazon Web Server. So it's there on AWS, and now we have these 3 mobile apps which are attached to, which are integrated to this web portal. So Sunburst Viva is our patient app, and what this app helps the patients to do is to register, to fill up his personal details, to complete his health information, so that it can be accessed by the doctor, the caregiver, the admin, and also he can buy services on the app. So if he wants to buy something, there is a payment gateway integrated with this app, and therefore he can buy the services that he needs. Also, he can give us feedback, he can request for support, he can also do video consultations or audio consultations using this app. So he can book an appointment for a doctor, and then this app can be used for consulting the doctor. We have another app called Sunburst Hygiene. What is Sunburst Hygiene? This is the app for the caregiver. We have a lot of nurses or attendants who go to the patient's home to give care. Now, first, they need to be told, something about the patient, his age, his weight, his address, his so many. So all this is from the Viva app. It is seen onto the Hygiene app. So the caregiver has access to the patient information. He will check in and check out on the patient app, on the caregiver app. So when he reaches the patient's location, he can check in, he can check out. This is also geotagged. Also, he can enter the patient's vitals onto this. He can see what duties he has been assigned, what tasks are to be completed, and he can also mark the completion of these tasks, so that the admin is also aware of how the care is proceeding. Now we have a third app called the Asclepius app, Sunburst Asclepius. Asclepius is the Greek god of medicine. So this is the app for the doctor. And what does your doctor do? He is able to see the information of the patient that he has been assigned. He can see his appointments. He can do the video or audio consultation for the patient. He can see the patient's prescriptions, etc. He can prescribe on this app. After doing the consultation, he can prescribe using this app, and the prescription goes to the Viva app, and the patient can see the prescription on the Viva app. So it is, what we have tried to do is to connect the dots as far as the whole operation goes. And we of course, this is the first version or second version of the app. The apps will be live on both the iOS as well as the Play Store, and we want to keep developing this technology bit as we go forward. And so the market that we are trying to target, the rollout plan is like this, that for us, if we get a good partner, all cities are good. And we are happy to partner with good people in any city in India. However, we had to kind of zero in on which are the locations that we would be preferring to start with, because we have to start somewhere. We cannot start all over at the same time, and therefore we kind of highlighted which are the places which we would like to start with, like Delhi in north, and then other places like Chandigarh, Ludhiana, Jaipur, Lucknow, Kanpur in the north. West, we definitely want to focus on. So Mumbai, even though we have a partner in Andheri, we can still look for partners in main Mumbai, in Thane, in certain other locations, maybe Panvel, I don't know. Pune also, we will look for some more penetration. Nagpur, Ahmedabad, Surat, Vadodara, then a lot of places in MP, because again, I'm familiar with I am a alumni of Jabalpur Medical College, and I have certain association there. Goa is a place which I would look at. This belt in Maharashtra is important to us. Again, some places in the south, these are serviced to a large extent, but however, we do want to have a presence there as well, also to some extent in the east. So why Sunburst? So one, there is a big demand for home health care and for elder care services. But as I said, it's not just elder care, it is home health care, which is comprehensive. We are there. We have developed a system which works. We have created a model which is profitable. We have created our technology to support this model. And so we are now well placed to take this forward. And then the franchisee can use this knowledge. They can, they can take advantage. They can leverage our experience, our expertise in the category. And I'm sure this is a workable model. This is a profitable model, and this is all set for high-speed growth in the near future. And so, Sunburst Healthcare, our aim is to provide care from the heart in the comfort of your home. Thank you very much. If there are questions, I will be happy to answer.
Thank you so much, Dr. Malik. And this was very detailed. I think this was 1 hour of a very detailed presentation. We have covered every important aspect, right from the offering to the proposition that we're offering to a franchise partner. And friends, I will also request, if you have any questions, instead of raising hands, please put your questions in the Q&A box. And we have the privilege of having Dr. Sujata Malik herself on the webinar. So any questions that you might have, we'd like to pick that up. And also, I'd like to maybe add about Dr. Sujata Malik. She started her journey of becoming an entrepreneur after serving some of the leading chains of hospitals of India. And she also had the honor to serve as a doctor in the Indian Army at the very start of her career. And between Dr. Sujata and her husband, the couple has more than 75 years of collective experience in the healthcare and administration. And so I also did some reading, and I understood this venture which Dr. Malik has started. It came from a very personal experience incident that took place, as you know, her father was in need of some home care services, and she realized there was no organized or reliable player to trust with such a situation which was as sensitive as healthcare. And today, if you look at the overall industry, of healthcare, while this is one of the biggest in the country, but also home care services in healthcare has come into the mainstream. It's already a 5 billion market, and it's very vast to include many categories, products, services, from preventive, curative, and like Dr. Malik also mentioned, it is not just about medication and treatment, but it also includes a lot of lifestyle diseases and management of the same, and hence not just limited to elderly services. The need of today, especially when it comes to players like them, is to have a provision of collaborative, integrated, and most importantly, I would say user centric services. And this is what overall ecosystem has been lacking. And what they've tried to give an answer to the problem is they've transformed that through technology, which I would say is a real force multiplier. So when you look at services like this is a care which is available, but is also personalized and selected by the patient, where you can select what services and from whom you need these services. And comparatively, I would say it's low cost solution at home and provides a lot of convenience for both the caretakers at home and also for the patient. And like Dr. Malik mentioned, this is a asset light model which does not require a huge infrastructure investment, and starts with a small investment of 12 odd lakhs, 12.75, with a 200 square feet of space which is required. So Dr. Malik, while many of these questions, in the course of the presentation has been answered, but I'll start first and foremost, on the business model itself. So we've talked about an average of about 1200 odd rupees as an average billing, and close to 750 bookings is what we're talking about, ideally what a franchise partner should be able to do, which translates to about 9 lakhs of the revenue. Now, when we look at this equation, I like to understand what kind of services in all are we providing to a patient, and if we have to even segregate the percentage of these services, which are the main services that are provided, and what quantum or percentage of these services are there. And also, how long does it take to reach that level of 750 patients? I'm sure it takes certain amount of time to reach that level. If some understanding around that can be given, would be very helpful.
Yeah. So, as I said, we try to cater to every possible need of the patient who needs home healthcare. So, whatever is healthcare, what can be delivered at the patient's home, we try to deliver. I'm sure every unit will develop its own core competencies. So, some will focus on maybe physiotherapy, some will focus on nursing, some will focus on doctors, teleconsultations and visits of doctors and so on. What we try to do is never say no to the patient. We make sure that there is something available, some complement available to address every need of the patient. So whether it's a laboratory, if he wants a laboratory test or needs a laboratory test, we are there. If it's a preventive health checkup, we are there. If it's a pharmacy item which needs to be purchased, again we can easily provide it at the patient's home. So it is a one-stop shop. It is not giving you fragmented services as far as home healthcare is concerned. there is a large element of home healthcare, which is nursing services. This is by far the most lucrative and high return aspect of home healthcare. So people have never understood it in the past, but as we are now understanding home healthcare, even I had never worked in this space for any length of time, so I did not understand it this well. Mm, Coming, when I started working in this area, it was as if I had started a nursing bureau, because people don't understand home healthcare beyond a nursing bureau. So it was very interesting. Actually, I understand how much nurses contribute to home healthcare. It is absolutely yeoman service that these nurses are providing, and it is of very immense value to the patient, because somebody being present with you 12 hours of the day, 24 hours of the day. Some of our nurses are basically they are not the there are people who we call patient caregivers, who are not qualified, but they are the attendant kind of services. So there is a need for these kind of people, there is a need for qualified nurses. So we have both categories. So there are people who only need assistance with their activities of daily living, who can work with people who are not qualified, and this aspect also we cater to, because we find that there is an immense need. The outcomes change if you provide these kind of services. If a nurse notices a change in the vitals of the patient and they reach out to us fast, we are able to provide a doctor to reach there, or we are able to take the patient on a call, and we address the problem. So a large portion and the most paying portion of this whole industry is definitely nursing. Nurse. So that is, I think, one can never lose focus of that, because even in hospitals, you would understand that it is the nurse who remains with the patient for the largest amount of time. So everybody else comes and goes, but the nurse is there. So it is important that we understand that this aspect has to be catered, and this is going to be the mainstay of home healthcare always. Physiotherapy can come in, doctors can come in, a nutritionist can give advice, a psychologist, if required, can be called in, but the nurse is there. And this is the one which is the biggest revenue driver, and has to be looked at.
Right. And Dr. Malik, I asked the second question on the business model that we talked about, 750
Sorry.
patients. So
Yes.
how does that work out?
So again, your 750 numbers to reach, it will take you about say about 6 months. And basically the thing is that how well you align yourself with hospitals, with doctors. In fact, even more than hospitals, I think doctors are the people that you need to gain confidence of, because they are the ones who refer patients. I have had the opportunity to align, because of my association with large hospitals, they were open to allowing me to have association with them, and they gave me an office inside the hospital also. But what I found is, if you align with one hospital, the others take a little, this step back. And the other thing is that unless the doctor refers, the hospital management has no say in it.
Right.
So the focus has to be doctors. So the physical marketing has to be addressed to doctors. The connect that you have with doctors is of paramount importance. Once they understand that you are doing a legitimate professional job, and that your patient is going to benefit, and the patient can go home quicker, and they will always be in connected with the patient. So we never try to encroach on the doctor's space. We always make sure that he is kept updated, that he is told that the nurse will give him a call when necessary. The nurse will inform us, but at the same time, we always keep a liaison between the original doctor who is treating and the patient. So when they know that there is no threat to them or their practice from us, they start falling in line, and it is actually the doctors who are the primary drivers in the initial stage. Later on, the patient will start recommending you. Right. The patient will start telling his near and dear ones, and of course digital marketing plays a big role. So all these aspects, when they come together, a doctor, a hospital is good to, kind of have a, as I said, a brand value, that people start saying, okay, yeah, if he's trusted by such and such hospital, then he must be somebody of standing.
Correct.
So for that reason, hospitals, your corporates are very important, because they will give you a bulk of patients. And that we have seen that, you don't have to go from like on a B2C kind of arrangement. But B2C, keep it at the back of your mind, because that is also bread and butter, and we should not lose sight of any business.
Right.
Um, so doctors will recommend you, patients will recommend you, and then your digital marketing and reaching 750 services means, say a patient is taking nursing service, then 2 services in a day, 12-hour shift. So then actually it is 60 services in 1 month, and each service costs somewhere between 1200 to 1500. So this is how we have come to that figure of 1200. And 750 is not something which is not achievable. If you were to have 12 such patients, you are already doing 720 services.
Okay. So what we have taken is we've talked about these services. So these are not unique 750 patients. So these are
They
services.
are not
So one
750
patient
patients. They are
might take 10
750 services.
services, right? So even if you have one patient, which is booked for a week, so this would translate to about 7 odd services which are taken
Correct.
by a patient.
And it's
Helpful.
perfectly doable. Means 6 months, I'm taking it as somebody who's really not enterprising enough. If you were, 2 to 3 months is enough.
Right.
Once
And
you
these
find your
services are
feet.
required, when, especially if we talk about today with the hospital condition, the ratio of hospital bed, patient, doctor, all that put together creates a lot of discomfort, both for the patient and the family. And couple of more questions, Dr. Malik, which I'll ask, and I see many questions which I am actually reading, in the Q&A also. I'll start taking up them too. But to start off with, we talk about, this stakeholder, the community, which is patients, doctor, and also the caregivers. So as maybe a new partner which comes on board, where does he get started with? That's something, of importance. Does he go and start reaching out to patients to get on board? He reaches out to doctor, reaches out to caregivers. So what is your advice on getting started? That's the most important part. And my second question was also building predictability, because this is a very sensitive business. If I have a patient and I need to have a nurse attached at the home, so how do we build predictability of doctors and nurses at the time it is needed? Because these kind of services do not have a big turnaround time. If I don't get a service, I'll reach out to somebody else who's available. Over to you.
Correct. So what we do when we set out is first create a supply. So, some reasonable supply should be built up of people who are dependable. So it should not be that, you start catering to demand without having something to supply them with. So, our connections with professionals have to be then exercised. So reaching out to nurses, there are agencies which are providing, in the business of providing nurses, some amount of, first initial connects with such people, and getting a base of, or a database of some people who will be available to you when the service is requested by your client. So do not start without a supply chain ready to service patients. Second is that you should be, never raise the expectations of patients which you cannot fulfill. So they should be realistic. So what I tell all our patients at the outset is, we are not an emergency service. Why we do it is that there are a lot of risks if you start by catering to emergency services initially. You should understand that we are a planned service. So what is a planned service? You will give us a requirement. Within a few hours, we will get back to you with what we are going to provide you. You will approve that. you will say, yes, please go ahead and provide at this rate and under these circumstances. So everybody is clear, what are we going to do? And then we do it. So then when we do this, we are able to satisfy the customer to a large extent, and we are able to make it a predictable service. The supply chain is very important. We have to, and we have our working on how to create that. What are the kind of profile that we look at? What are the documentation that we need to do? So all this has to be in place. You can't go random, and that is our importance, that we understand this business. We have run it now successfully for 3 years. We have made it profitable. We know what we are doing. So then we speak from a position of confidence. It is this model that we want to replicate in every location. We want our franchisee partner to be profitable. It doesn't make sense if he's there and he's not profitable. It's
Right.
of no use to anybody. So
Right.
that's what it is.
Yeah, Dr. Malik, couple of questions, before we conclude. And friends, I'll try and pick up as many questions as I can. And rest of the questions, I will request, we can take up on a discovery day that we have kept for all of you. I'll take one question from Mr. Rishi Bansal from Mohali, Chandigarh. He says, I'm not from a medical background, and how exactly as an investor I can be a part of the startup, and the city's Mohali, Punjab. And I saw another question also, and a couple of questions from him, and maybe if these can be answered together. While you did answer that for a new person, it is not a no-go, while he would need maybe a little higher gestation time because they don't come from that industry, and making inroads and those relationships might be a little difficult. And the second question he also asked is, if you could explain the 30% franchise fee after the manpower cost, how exactly
Yeah,
is that calculated? Yeah.
yeah. So uh, again, a person who is not from the industry is most welcome to come in as a franchisee, because you have to have common sense. You have to have that understanding of how to do a business. Um, and but I would always say that in red I had put that point, that I would say that somebody from a healthcare background must be associated. And when we select our franchisees, we will be looking for that. Who is this person that will take charge of the medical aspect of it? Because it is healthcare finally, and you have to understand it. So we are happy to hold your hand, but we want somebody with you who is a healthcare professional. It is not expensive to do that. You can do it very easily, and this same person can actually run your operations also. So it is easily doable, but the person must be ready to work in this space, and must be open to listen, hearing from us, implementing things the way that we think are right, because we have already experienced this. We have experience in this field, and we would give you the right advice. So if you are doing that, and you have a healthcare person on board, there is no question, there is no reason why somebody who is not from the industry should not become a partner.
Sure. And Dr. Malik, another question which I'm seeing coming in again and again from many of our viewers is on the manpower, and especially when we talk about manpower, that's the heart of the business. So
Yeah.
what they're asking is there any assistance which the company also provides against the manpower services?
Okay. So I forgot to address the other question, which was about the 30% share.
Yes,
That
yeah.
so I will be clubbing that with this one. Now, as far as the manpower is concerned, see, when we set out, we did not have access to any manpower. So we adopted a certain model to get a manpower base in place. And now today we have about 250 people who regularly do services with us of various categories. So since we have run a successful business, we know how to get that manpower. So our knowledge we are going to share with you. Don't please go with the impression that we are going to come there and recruit manpower for you. We can't do that. But we will, and today the world is so connected. Sitting in Pune, I can access anybody anywhere. we did a lot of groundwork for the Mumbai franchisee as well. So then now they are in a comfortable position to have their manpower to whatever, to service whatever requests come to them. So we will do the same with every franchisee. We will be in touch with them. We will guide them on how to get the manpower in place, the kind of conversations that and the concerns that the people have, the workforce has. We will be able to address them because obviously, everybody has the similar concerns. So how to, connect with them and how to deal with them is what we will bring to the table. About the share of Sunburst Healthcare in the margin. Now you have a certain revenue, 9 lakhs. Out of this, 70% will definitely, if not 70, 60, 65% will go out as the payment to the professional who is doing the service on the ground. The rest of the amount is what is to be divided between Sunburst and the franchise partner. The franchise partner gets 70%, Sunburst gets 30%. This is the model that we adopt. And this is how we have been working with the Mumbai franchisee as well. And it is working well. So,
Right.
yeah.
Okay. And
But
this
the other costs are nowhere, they are to the account of the franchise.
Sure. I'll take another, and that's an interesting question which is asked by Mr. Mayur Kangar. He's asking, to what population size of a city would they be able to achieve that, 750 bookings in a month? And maybe I'll club another question. When we give a prospective partner the rights, do we take certain demographics, geography, radius into consideration?
Now, the thing is that, as I explained to you, 720 services means 12 patients on board. So it's not something which is not achievable. It's achievable in a reasonable amount of time, 2-3 months. Actually, I would say you should be able to achieve it. There's no problem at all. And this does not, but what we try to do is we cater to the length and breadth of the city. So as Sunburst, even though I know that I cannot, I can provide services anywhere in Pune. So Pune is not a small city, but we are able to provide services everywhere. Same thing, you as a franchisee, you are entitled to provide services anywhere in the city. We may have another franchisee 15 kilometers from you or 10 kilometers, whatever is decided. He will have the same right, but we will not place a franchisee right in front of your office.
Sure. So while there'll be a thumb rule, but depending on the opportunity, that can be
If you
disruptive.
get a patient from anywhere, why shouldn't you service? Now, today I'm sitting in Pune. I got a patient in Shirdi. Why will I say no to him? I will say yes. If I'm able to service him and I'm doing it effectively, fine, that's okay. The idea is to service whoever you can.
Right.
And everybody will have their own, people who will connect with them, patients that they have seen earlier who will recommend them. So if it comes from some area which is having a franchisee outlet, fine, that's okay. He will have his own clientele, you will have your own clientele. We will keep some distance between two franchisees, but you are entitled to take patients from anywhere.
It means even outside the city. You gave an example of Pune and Shirdi, so which can also be outside the
If I
city,
have the
provided
capability, I will do it.
provided you have that ecosystem
Yeah.
to service.
Yeah. And this confidence comes over time. It doesn't happen to begin with.
Sure.
It is as you start, finding your feet in the business, understanding the business, then you are able to do.
Right, absolutely, Dr. Malik. And maybe one more last, I've been saying last, but this definitely would be the last one. I don't have the name of the gentleman who's written this. He says, I'm from Delhi. I like to know, how do we get patients in a quick time frame is, I think, what he's trying to understand. And because he's also done this business in the past is what I was reading in the previous questions. And he was not successful because he didn't have too many people coming, while I think he had the supplier side and demand side is something that he was not able to turn around. So any suggestions, Dr. Malik, that you have on
I
this?
think I have answered this question earlier. So I would look at doctors. So, you should know where to go for your patients. So, and a healthcare person is important because he's the person who's going to be able to strike a chord with the doctor. You going to a doctor is never going to take cognizance. But a person with a healthcare background can talk the same language as a doctor. So having somebody on board who has a healthcare background will help you a great deal. Look at doctors. Once you get some patients, these are the patients who are going to recommend you. The cascade will flow once you have some patients that you have serviced effectively, and this is how all businesses run. When you service somebody correctly, properly, the patient is satisfied, he will recommend you to four other people. We also do a lot of digital marketing, and we will be doing digital marketing for you in your city as well. So I'm sure there is no reason why you should not be getting patients if you are going in the right direction.
Very helpful. And Dr. Malik, as we close, I will also request if there's anything that you want to tell the entire audience who's listening to you, both live and also on the webinar, as a closing message.
So the closing message is that this is the time for home healthcare. It is beginning to show up as an important aspect of healthcare. I have just proved to you that using very little resources, you can develop a very lucrative and a very paying business. In fact, I started very small. I could start. I became profitable within a year of starting operations. I don't know, and I was never a person who knew business or anything. So if I can do it, I am sure you can do it, and maybe you can do it much better than me. So I am looking forward to a lot of very exciting partnerships from this interaction, and I'll be happy if people reach out, and we will be we will do everything in our capabilities to help you set up this business, to run it effectively, to make it profitable, and make it a win-win for all parties involved.
Great. Thank you so much, Dr. Malik. And I would again say it was a really informative session that we had. And I will also announce that we have kept 28th of July, which is the next week, which is Wednesday, where we are doing a discovery day with Dr. Sujata Malik. And any questions that you have on the business model, any discussion that you want to do on your city prospects, we can have Dr. Malik's presence over a call or maybe a Zoom that you can do. And I will also request friends, whosoever is keen, to bring your inner circle, whosoever is a partner to this business, your friends or somebody in the family who's also maybe recommending the business. It's always helpful to bring your inner circle when you do these meetings. And Dr. Malik, thank you again so much for being with us. And
Thank
I
you
will
for
now
having me. It was
thank you so
pleasure.
much. I will now request Archana to kindly take over for the concluding remarks.
So thank you so much, ma'am, for joining us today and giving us this opportunity to represent your brand to all the investors who have joined us today. We look forward to have very successful discovery day on 28th. We would like to thank Sonia, ma'am, for her time. Dear friends, thank you so much for joining us today. You can reach out to us at our business hotline number, which is 9717683838. We request you to save this number in your phone book so that you get a regular updates from our side. Also connect with us, join us at a different social platform handles we have. We are available at Facebook, Instagram, Twitter, and LinkedIn. You wish to join Gaurav sir and Sonia ma'am, you can do so by joining them at their respective LinkedIn IDs. Information we have just shared on screen. And today we wish you to join us for our Bharat Franchise Show, which will start at 7 p.m. This is an initiative again by Franchiseindia team, where our aim is to invite top brands for you. You digitally interact with them and you understand the entire business model. So to understand the entire business model of these top industries, top business, please do registration either at our business hotline number, or you can also go to Facebook page. We have shared the registration link. Do registration right now. And tomorrow under business opportunity over chai 12 p.m. webinar, we are inviting you to join us for F&B vertical brand Scoop and Stick. That's the brand we are bringing for you. You can start your business, this particular business, with 20 lakh rupees. So do registration for our Bharat Franchise Show as well as our 12 p.m. webinar show tomorrow. Thank you once again for joining in today. Have a great day. Stay safe. Thank you so much.